Welcome back and thanks for staying with us. In this evening's health report, Shamela Pullen looks at pain management.
Pain is a physical sensation triggered in the nervous system. A person may feel it as a prick, tingle, sting, burn, or ache.
From an emergency room perspective, we can classify these into traumatic events, infectious events, inflammatory events. One that comes to mind that we see quite often in the emergency room are patients with sickle cell disorder. And these patients usually visit the A&E very often, and not to mention cancers.
Pain can either be acute or chronic. Several methods, including pain medications, are usually used to treat pain. But persons are warned about taking too much medication to avoid overdosing, which can be dangerous.
A patient can purchase Tylenol, for example, which is a Panadol, another name for Panadol, and if you do take a certain amount in a short time based on your weight, and worse, if you have chronic illness that impair the excretion of Panadol, you can get liver failure. And ultimately, if the patient does not have urgent attention, death from liver failure.
But there are other non-drug treatments such as physical therapy, relaxation techniques, and meditation.
Breathing in, breathing out, walking around, and try to relax in their own way, because each patient will obviously have a different approach. But understanding the idea of what in that individual has that is causing the pain, for that individual to be educated and have knowledge of prognosis, and having input from their relatives, and of course choosing the best medication, which would be something inexpensive, minimal side effects, and something which works.
With your health report, I'm Shamela Pullen, wishing you good health.